We visited a number of hospitals and health centers, and people there told us that the community health insurance scheme known as Mutuelle de Sante has been a godsend, but certain challenges still do exist. Healthcare under Mutuelle is good because we do not spend a lot of money. Sick people are no longer forced to stay at home as their condition gets worse. With just 200 Rwandan francs, they can conduct all necessary tests. However, for conditions like high blood pressure that I suffer from, some forms of medication are just not available here, and we have to go and buy them elsewhere at great cost. It would be better if they required us to pay a certain portion of that money here, with Mutuelle covering a certain percentage, however small. Treatment here is not expensive at all because they do not ask for a lot of money. The only challenge we face is when they prescribe expensive medicine that we must buy elsewhere. When they urge us to pay our Mutuelle contributions, it should be so that we do not have to pay a lot when we seek medical treatment. A parent may be used to paying no more than 2,000 Rwandan francs for tests, only to be told that more is required. I had to pay 4,800 Rwandan francs for my child's tests. Officials at the Rwanda Social Security Board say measures have been taken to strengthen the community health insurance fund in order to address these and other issues. We agree that money can be extracted from communication companies, 2.5% of their profits, get money from traffic violations, from the Motor Vehicle Inspection Center, and even more from medical research procedures. All that has been done and the money has been increasing. However, most importantly, the government has increased the budget for this community health insurance fund. We added an extra 6 billion Rwandan francs or something close to that, and that has helped us to start closing the 20 billion Rwandan franc deficit we had, which is not little money. We believe we could get around 10 billion Rwandan francs. 13% of the Ministry of Health's budget was going to Mutuelle de Sante, and that was before the additional 6 billion Rwandan francs the government is now injecting. Other sources, as previously mentioned by RSSB top officials, are 2.5% of profits from the communication companies, 50% of medicine and equipment registration fees, 10% of profits from the country's gambling sector, 50% of funds received at the Motor Vehicle Inspection Center, 10% of all fines collected from traffic violations, all fines imposed on medicines that do not meet required quality standards, taxes collected from city parking facilities, 0.5% of worker salaries, 10% of tourism revenue from certain districts, 20,000 and 10,000 Rwandan francs, vehicle and motorcycle transfer fees respectively, 4,000 Rwandan francs per hectare of marshlands, 5,000 Rwandan francs for land up in the hills, and 2,000 Rwandan francs for terraces, 5% of all health insurance profits from private insurance companies, and 10% from the public sector institution in this respect. An extra 20 Rwandan francs per litre of petroleum goods sold in the country will also be collected and go towards the fund that up until now brought in revenues amounting to 32 billion Rwandan francs, but was incurring expenses of more than 50 billion Rwandan francs, hence the 20 billion deficit mentioned at the beginning of this report.